Eczema, or atopic dermatitis, is a chronic skin condition causing red, itchy patches. While its exact cause is uncertain, genetics and environmental factors play a role. Symptoms include dry skin, itching, and inflammation. Management involves skin care, lifestyle changes, and sometimes medication. Here are 14 remedies commonly used for managing eczema. Number 1. Moisturizers. Keeping the skin well hydrated with moisturizers can help prevent flare-ups and soothe existing symptoms. Look for fragrance-free and hypoallergenic options. Number 2. Topical corticosteroids. These are anti-inflammatory creams or ointments that can help reduce itching and inflammation during flare-ups. They should be used under the guidance of a healthcare professional. Number 3. Topical calcineurin inhibitors. These medications help reduce inflammation and itching and are often used when other treatments haven't worked or for sensitive areas like the face. Number 4. Antihistamines. Oral antihistamines can help relieve itching, especially if it's interfering with sleep. Non-drowsy options are available for daytime use. Number 5. Wet wrap therapy. This involves applying moisturizer or medication to the affected skin and then covering it with a damp layer of clothing or bandages to lock in moisture and enhance absorption. Number 6. Bathing practices. Take short, lukewarm baths or showers using mild, fragrance-free cleansers. Avoid hot water, as it can dry out the skin further. Number 7. Avoiding irritants. Identify and avoid triggers or irritants that can exacerbate eczema symptoms, such as harsh soaps, certain fabrics, or environmental allergens. Number 8. Wearing soft fabrics. Choose soft, breathable fabrics like cotton and avoid rough or scratchy materials that can irritate the skin. Number 9. Humidifiers. Using a humidifier in dry indoor environments can help prevent the skin from drying out, especially during the winter months. Number 10. Bleach baths. Diluted bleach baths can help reduce the risk of skin infections, which are common in people with eczema. However, this should be done under the guidance of a healthcare professional. Number 11. Stress management. Stress can worsen eczema symptoms, so practicing stress reduction techniques such as meditation, yoga, or deep breathing exercises may be helpful. Number 12. Probiotics. Some research suggests that probiotics may help improve eczema symptoms by promoting a healthy balance of gut bacteria, but more studies are needed to confirm their effectiveness. Number 13. Wet compresses. Applying cool, wet compresses to itchy areas can provide relief and help reduce inflammation. Number 14. Dietary changes. Some people find that certain foods can trigger eczema flare-ups, so keeping a food diary and avoiding known triggers may be beneficial. Common triggers include dairy, gluten, and certain fruits and nuts. Remember, it's essential to consult with a healthcare professional before starting any new treatment regimen, especially if you have severe or persistent eczema.